Have you ever walked into your kitchen only to forget why you came in? Or maybe you've stood up from your recliner and your legs just didn't feel strong enough to hold you. If that's happened to you or someone you love, you're not alone. And no, it's not just old age. As a brain doctor with over 30 years of experience, I can tell you this muscle loss in older adults is not a normal part of aging. It's a silent warning sign, and left unchecked, it's one of the biggest reasons older Americans lose their independence, fall, and never quite get back up. In fact, according to a study by the CDC, over 36 million falls are reported each year among older adults in the United States. That's about one fall every second. The worst part. Many of these falls come after years of small, silent signals, leg cramps at night, needing two hands to push off a chair, or feeling exhausted after walking just one block. Have you noticed any of those in yourself or a loved one? Comment 1 if yes, or 0 if not yet. I read every one. I care. Today. I want to show you the hidden causes of paranoia and aging, not from a place of fear, but from compassion, because when the brain struggles, the muscles suffer too. And when muscles weaken, the mind loses its balance literally and emotionally. This video could be the most important conversation you've had with your body all year. Let's begin. Number 1, infection or insanity. When UTIs mimic dementia, let me tell you a story that still haunts me. A woman in her 70s, let's call her Martha, was rushed to the ER by her daughter. Just yesterday, she had been chatting, folding laundry, and watching her favorite baking show. But that morning, she accused her granddaughter of stealing her jewelry. She refused to eat. She didn't recognize her own reflection. Her family feared the worst. They whispered words like Alzheimer's. But it wasn't dementia. It was a urinary tract infection. Yes, something as common and treatable as a UTI had hijacked her brain. You see, in younger people, a urinary tract infection might cause burning up, urgency, or lower back pain. But in older adults, especially those over 65, it can cause confusion, agitation, paranoia, even full-blown delirium, and sadly, it's often misdiagnosed. According to the National Institute on Aging, 1 in 3 hospitalizations for sudden confusion in older adults is later traced back to an untreated infection. That's 1 out of every 3. Here's why this happens. As we age, our immune systems slow down, our nervous systems become more vulnerable to inflammation. So when bacteria travels from the bladder to the bloodstream, it can disrupt brain function fast. And it often looks like mental illness. It's terrifying for families and patients alike. But there is good news. With proper antibiotics, hydration, and rest, many patients recover completely in just a few days. I've seen it happen. And that's why I urge every caregiver watching this, if your loved one starts acting off suddenly suspicious, forgetful, or even combative, ask for a urinalysis. Don't wait. Don't guess. Trust your instincts. Because sometimes it's not Alzheimer's. It's just bacteria. And it can be fixed. Comment yes if you've ever seen a sudden, strange behavior in an elder you love. Or comment no if this is new information for you. I'd love to hear your story. Number 2, dementia's dark side, when memory loss turns suspicious. Let's talk about something most families don't expect, suspicion. When we think of dementia, we imagine forgetting names or losing track of time. But what many people don't realize is that dementia can also change how a person sees the world. And that change isn't always gentle. Over my 30 years in neurology, I've met dozens of older adults who weren't just confused, they were convinced that someone was lying, stealing, or plotting behind their back. And in their minds, it felt real. One patient, Mr. Lewis, used to hide his mail every day. Why, he believed his neighbors were spying on him through the window. And when his wife tried to explain, he'd shout, "You're one of them." Now here's the truth. Mr. Lewis wasn't paranoid because he was angry or mean. His brain was trying to make sense of missing pieces. That's what dementia does. It scrambles memory, mixes up timelines, and blurs reality. And the brain fills in the blanks with stories that can feel terrifying. According to the Alzheimer's Association, about 40% of people living with Alzheimer's disease will develop some form of delusion or paranoia. That's not rare. That's nearly half. Here's what's heartbreaking. Families often get frustrated. They argue. They try to prove what's real, but this usually makes things worse. So here's my advice. Gentle, but firm. Don't argue. Instead, validate the feeling even if the story isn't true. Say things like, "I can see this is really upsetting you." Or, "Let's find your things together." Because what your loved one needs most is not correction. It's comfort. The brain may be changing, but the heart still remembers safety, kindness, and love. And when you respond with calm and care, you protect their dignity even in confusion. If you've ever had to calm a parent or grandparent in distress, comment, "I've been there." You're not alone. Number 3, pills that twist the mind, medication-induced delusions. Let me be honest with you. Some of the scariest cases of paranoia I've seen didn't come from illness. They came from the medicine cabinet. Yes, I've treated patients who suddenly thought their children were imposters, who saw people in the room who weren't there, and who became terrified to sleep at night. And in more than a few of those cases, it was the pills. One woman in her 80s, let's call her Ruth, was prescribed a sleeping pill after her husband passed away. Within a week, she started hearing voices. She refused to eat. She thought the television was talking to her. Ruth wasn't going crazy. Her brain was reacting to diphenhydramine, a common sedating antihistamine found in many over-the-counter sleep aids. Here's what most people don't know. As we age, our liver and kidneys process drugs more slowly. Even a dose that's safe for a 40-year-old can be overwhelming for someone in their 70s or 80s. And the older the brain, the more sensitive it becomes to chemical disruption. According to the American Geriatric Society, medications with anticholinergic properties like diphenhydramine, amitriptyline, or oxybutynin are strongly linked to confusion, memory loss, and even hallucinations in older adults. These drugs block a key brain chemical called acetylcholine, essential for memory, attention, and mood. Block that too much, and the mind can spiral. But here's the good news. Most of these symptoms can reverse within days or weeks once the medication is stopped if caught early. That's why I always tell families, if your loved one suddenly changes, seems more paranoid, confused, or withdrawn, don't just think dementia. Pull out their medicine list. Bring it to your pharmacist. Ask your doctor. Is there anything here that could be making things worse? Because sometimes healing the brain starts with looking in the bathroom drawer. Have you or someone you love ever reacted strangely to a new medication? Type meds in the comments. If this resonates with you, I'd love to hear your story. Number 4, depression. Masquerading as madness, the silent psychosis. Sometimes the scariest changes in a loved one aren't loud. They're quiet. They come in the form of silence, missed meals, empty eyes, withdrawing from conversations, staring out the window for hours, and then one day they whisper something like,
everyone's watching me, or they're trying to poison my food, that's when most families panic. They think, this must be dementia, maybe even schizophrenia. But sometimes it's neither. Sometimes it's depression so deep, so heavy it tricks the brain into fear and distortion. And in older adults, this kind of depression often goes undetected.
In fact, according to the National Institute of Mental Health, over 6 million Americans over the age of 65 suffer from depression. But only 1 in 5 ever receive proper treatment. That means 4 out of 5 elders are left untreated, often misdiagnosed, or worse, dismissed as just getting old. But clinical depression in older adults is not just sadness. It's a full-body illness. It can cause pain, fatigue, brain fog, and yes, paranoid or delusional thinking. It can even cause what doctors call psychotic depression when deep sadness is mixed with hallucinations or irrational fears. I had a patient named James. He was 72. A proud Korean War veteran. He stopped shaving, stopped leaving the house, and then one day told his daughter, I know the neighbors are coming at night. I hear them. James didn't need antipsychotics. He didn't need memory pills. He needed hope. With therapy, low-dose antidepressants, and family support, James returned to walking every morning. He smiled again. He started living again. If someone you love seems lost in sadness, please don't ignore it. Ask gently. Get them help. Depression is treatable even at 90. And healing starts with being heard. If you've ever mistaken sadness for something else, comment silent below. Your story matters and it could help someone else today. Number 5. When the eyes and ears fail, sensory loss and paranoia. Have you ever tried talking to someone who couldn't hear you? You raise your voice. They look confused. You repeat yourself again and again. And suddenly, they snap. They accuse you of shouting, of hiding things, of talking behind their back. It's heartbreaking. But it's not always about personality. Sometimes it's about perception. As we age, our senses become dull. It happens slowly, so slowly we barely notice.
But to the brain, a missing sound, a blurry image, feels like missing information. And the brain doesn't like missing pieces, so it fills in the blanks, it guesses, it imagines, it creates stories that sometimes turn into paranoia. According to the Journal of the American Geriatric Society, untreated hearing loss in older adults is strongly associated with cognitive decline, social withdrawal, and yes, paranoid thinking. That means when Grandpa doesn't hear you clearly, his brain might assume you're whispering about him. When Grandma can't see your face, she might misinterpret your smile as a smirk. None of it is intentional, but it feels real to them. And over time, the fear grows. The mind says, I must be left out. I'm not safe. They're hiding something from me. So what can we do? Simple. Start with the ears and eyes. Get hearing checked. Make sure glasses are up to date. Avoid background noise.
Speak slowly and clearly, but never like they're a child. And most of all, stay patient. What looks like confusion might just be a world going dimmer and quieter. And you can be the bridge back to clarity. Have you ever noticed paranoia in a loved one with hearing or vision problems? Type sense in the comments if that resonates with you. Your voice matters here. Number 6, isolation and elder abuse when paranoia is actually protection. Not every paranoid thought is a symptom. Sometimes it's a signal, a warning flare, a cry for help. Over the years, I've met elders who whispered, they're taking my money, or they come in at night when I'm asleep. At first, families think it's a delusion, but sometimes it's not. Sometimes it's true. According to the National Council on Aging, about 1 in 10 Americans over the age of 60 have experienced some form of elder abuse, whether it's financial, emotional, or even physical. But here's the heartbreaking part. Only 1 in 24 cases ever gets reported. Why? Because fear and shame silence many victims. And because when an elder already has memory problems, their words are often dismissed. But we must not ignore these whispers. When an older adult becomes paranoid only around one specific person, when they suddenly flinch at touch or stop answering calls, when they give vague, uneasy answers, it's not just aging. It could be trauma. It could be real. In my practice, I've worked with families who, after dismissing a parent's paranoia, later discovered hidden bank withdrawals or unexplained bruises, or a caregiver with a past. So, what can we do? First, believe them, at least enough to check. Second, ask open questions. Not yes, no ones. Is anyone making you uncomfortable? Has anyone touched you in a way you didn't like? And third, pay attention to small shifts, behavior changes, sudden anxiety, missing belongings. Because sometimes paranoia isn't confusion, it's survival instinct. And you might be the only person who sees it. If you've ever doubted yourself for speaking up, or stayed silent because you weren't sure, comment, listen below. You are not alone, and your intuition matters. What should you do? 3 first steps. If a loved one becomes paranoid, let's pause, take a breath. If you're watching this video because your mom, your dad, or someone you love has started acting suspicious, withdrawn, or fearful, you're likely overwhelmed. I get it. I've sat in the same room with hundreds of families, hands trembling, eyes searching for answers. So let me offer you 3 things. Clear steps that can help you feel more grounded and help your loved one feel more safe. Step 1, don't argue, observe. When someone becomes paranoid, our instinct is to correct them, to say, no one's stealing from you, or that didn't happen, but correction rarely calms the mind. In fact, it can deepen the fear. Instead, observe the pattern. Write down what they say, when it started, what time of day, around which people. This helps your doctor see the full picture. Step 2, review medications and health. Bring their full medication list to a pharmacist or primary care doctor. Ask directly, could any of these cause confusion or paranoia? Also, check for hearing loss, vision problems, infections, or even recent grief. Sometimes, paranoia is the brain's way of saying I'm struggling. Step 3, create calm, predictable routines. People with paranoia often feel out of control, so give them anchors. Eat at the same time each day. Use soft lighting. Avoid loud news on TV. Speak in a low, steady voice. Familiarity builds trust, and trust softens fear. I'm not saying this is easy, but I promise you it is possible. You are not alone, and your presence, your calm. Your effort makes a bigger difference than you know.
Comment plan if you'd like a simple checklist version of these 3 steps. I'd be happy to send it your way. The gentle truth and where you go from here. If you've stayed with me this far, thank you. That tells me you care deeply about someone, maybe your father, your mother, maybe even yourself. And that matter, because paranoia in aging isn't just about confusion. It's about fear, about change, about a brain that's doing its best in a body that's shifting, and you you're doing something powerful by simply paying attention. You've learned that sometimes. Paranoia isn't delusion. Sometimes it's a reaction to infection, to grief, to bad medication, to fading senses, or even to trauma. You've also learned what not to do. Don't argue, don't assume, don't ignore, and most importantly, you now know what to do. Observe, ask, support. Let's be honest, aging can feel scary, but knowledge brings peace, and presence brings healing.
If you've made it this far, I want to invite you to take the next step with me. In our next video, I'll show you the 5 core traits of dementia, the real, often misunderstood symptoms that go beyond forgetfulness, because the earlier you can recognize them, the more compassion you'll have, the more clearly you'll act, and the more calmly you'll care. So before you go, leave me a comment. Have you ever experienced a moment of fear or confusion in someone you love and didn't know what it meant? Your story could help another family feel less alone. And if this video touched your heart, please subscribe. We're building something beautiful here, a community of clarity, care, and connection. Let's keep protecting the brain before it needs saving.